Again, thank you for listening, and this is a continuation from our previous Healthcare Proposed Solution, EA, Beginning of Specific Topics, Part 2.
And believe it or not, these methods are so simple that can be instituted into the overall program by making regulation of a few sentences long and could be instituted within 1 day only. So let's just do it. The next topic relates to better health for the whole country. And when we have better health and more knowledge, we have more compliance with medications, with surgical postoperative, with medical plans. How do we get this better health? People need to be better educated in terms of health. While it is very nice in high school to learn of an ancient society in Rome and how they created these aqueducts, it's also important to know how your own body works. And I demonstrate how, from middle school onward, we are going to have mandatory in this country, in the schools, a health care or health education, not taught in the fashion as it always was, but taught by physicians, nurse practitioners, physician assistants, health directors. So there will be a position at the school that organizes the program, and they bring all these outside individuals in to give specific topics, teaching why, for example, patients do not need to inundate emergency rooms with a sniffle head cold asking for antibiotics. Antibiotics is bacteria. A simple sniffle head cold is usually viral. It won't work. But the patient will usually utilize insurance over and over, going to 3 different clinics until they get their prescription for antibiotic. And how about, instead of drilling in everyone's head, smoking causes cancer, smoking causes cancer, smoking causes cancer, what about demonstrating in these classes a black charred lung, showing what happens after 20 years of smoking in the lung versus a pink healthy lung from someone who exercises? I create a stepwise protocol as to how exactly this plan will work, how the physicians and providers will not be volunteering their time, but will be actually paid for their time to present this information in their local communities and schools from middle school on, how the schools can utilize this in their curriculum, and how overall, when we have students who end up as adults with a better basic knowledge of basic health, then there is a lot of overutilization, nonsense utilization, that won't be wasted anymore in the future. And that comes down to less expense, while at the same time healthier people. And isn't that the plan of our whole system? And isn't that the goal of our whole plan? And isn't that the goal of our whole nation, or the world as human beings? Healthier population. And this is another element of my system which can be created within a few simple weeks. I map out exactly how to do this. And finally, I address the insurance issue, identifying what is major health insurance for catastrophic events versus a health care plan, which is everyday usage, and premiums can be adjusted and manipulated between the two. I am not going to get into details now, but suffice it to say that when we identify the difference between the two and we map out the difference between the two and we organize this, we give more choices to people of what type of insurance or health care plan they want, and we give the allowance to the insurance carrier to modify premiums so they retain more funding, while at the same time giving lower premiums to those participants who want to purchase different type of plans. This is too complex of a description to put in this summary, but it is in my recordings, and believe it or not, is not complex at all to institute. The insurance carriers would like it, they will retain more income, and all the providers and all the patients will be fine with this method as well, because it gives more choices and allows the competent individual to choose wisely and save money in their pocket. So, of everything, there are my 15 topics that I have created with their specific itemized detailed corrections of these topics. 50% of them could be instituted within one day by just modifying regulation, and the rest would take simply a few weeks, and that's all. I am not saying we need to overhaul the healthcare system. I am saying that even if we do nothing to the current healthcare system, whether you want to call it Obamacare or Affordable Care Act, whatever you want to call it, you add in my structured regulations and protocols, and it is self-correcting. Self-correcting in terms of better finance, self-correcting in terms of better care. Between all my plans, I show how we can decrease the expenditure of healthcare at the insurance level, approximately 50%, and at the provider level, even down to the private practitioner, up to 60%, meaning the overhead of 60% lost at a private practice means that when they previously had to charge $100 for a medical visit, now they can charge $40 for that medical visit and make the same income. By my plan removing nonsense, unnecessary overhead where money is wasted. And then if you have to pay $40 for that visit, whether out of pocket or your insurance has to pay only $40 instead of the $100, look at the cost savings for you, for the insurance, and overall the insurances will be able to charge less premiums because there will be less costs being paid. This is a corrective system. Now that I have identified all of the topics, I welcome you to please listen to all the details that I provide within each topic. There are multiple 20 to 22 minute lectures of each of these topics, and most are so simple to create immediately. The passion I have, and that you hear in my voice, is not because I am a healthcare guru. It is because it truly pains me when logic cannot be used to fix a situation, and the current status of the healthcare debacle defies logic. I am providing such a simple method to fix the overall plan that most everyone, all providers, clinics, hospitals, all patients, which is basically everyone, would benefit, both financially and better medical attention. The only reason why the system of mine hasn't been used yet is because the current system is too complex for its own good. It has morphed into whatever it is now because it's never been handled right from the beginning. Let's handle it right from the beginning and make the snowball effect by infusing in my regulations and my structure and my protocol. It is self-correcting. And out of all my topics with each lecture to follow, there are even further details that I can discuss on each topic when the appropriate government official would like to address these. Thank you for listening, and I hope we will be working together shortly. Thank you for listening to these recordings so far. I know they have been a little wordy and a little detailed. Therefore, you can imagine how truly detailed my specific solution plans are. But the initial solution plans comprises 8.5 hours of lecture recordings. These are all available to be sent to you, and shortly they will actually be linked on this YouTube
channel. But I do want to give the government first chance for the correction of this, because I think we can all work together, and the details of how to do that are so simple and all mapped out. And as always, thank you for listening.